And get started. Thank you all very much for taking a moment to complete that quick poll question. Looks like we still have people filing into the virtual room, and so let's see. We're going to start our webcam really quickly here. And Sally and Melissa, feel free to go ahead and start your webcam as well here so that we can say hello to our wonderful audience here. So just wanted to, oh, and Sally, whenever you're, well, here, let me not let Melissa be the only one on camera here. I'll start as well. All right. All right. So again, welcome everyone, and thank you all so much for coming in and actually filing into the virtual room here. It looks like we have people that are continuing to join today's webinar, which is totally fine. But my name is William Moore, and I'm with OJJDP's InTech. And before we get started, I wanted to just run over a quick few items within the Adobe Connect webinar technology. But again, I wanted to welcome everyone and thank you all for joining today's webinar, Creating Trauma-Informed Child Welfare Organizations, brought to you by our colleagues at the Western Regional Children's Advocacy Center. Again, my name is William Moore, and I want to just go over a few technology features here in Adobe to keep in mind. Please note that this webinar is being recorded and will be available on our YouTube channel. On our YouTube channel, you can view past events that are archived, including this one that will be up in a few days. If you'd like to get any supporting materials that are related to today's webinar, you may contact the OJJDP TTA Help Desk, and here we'll be able to provide you with any of the handouts that are related to any of the webinars that you see on our YouTube channel. For those who are wishing to download a copy of any important handouts that are related to today's webinar, you may do so by locating the Handouts pod. Here, you'll simply click on the name of the document and click the download file, and it will download directly to the device that you're joining from. If you have any issues or need any assistance with downloading these files in the Handouts pod, you can let us know in the chat, or you can reach out to the OJJDP TTA Help Desk, and we can get those any of those slides to you, or materials related for today's webinar as well. Okay. Please note that we will have a dedicated Q&A portion of today's webinar. However, feel free to submit your questions throughout the presentation for today. If you have any questions for our presenter, we will have a chance where we'll go over those questions and the questions that are being submitted during today's webinar as well. So feel free to send and submit your questions through the chat box accordingly. Please note that individuals will receive a certificate of attendance at the conclusion of today's webinar. Note that the certificate of attendance will be received through an automated email coming from Adobe Connect. So be sure to check your inbox after the webinar, and also check your spam or your junk mail just in case for an Adobe Connect email that will include your certificate. Now, we're going to do a quick count of individuals who are in the virtual room, but then also maybe individuals who are joining those folks who are signed in. So if you're in a group, please type in the total number of additional people in the room with you today. If you're viewing alone or by yourself, there's no need to type anything at this time. However, if you're viewing in a group, meaning it's yourself and maybe one additional person or two additional people with you, you would type in those total number of additional folks that are in the room with you today. So please take a moment, just go ahead and type in, let us know how many additional people are in the room with you today. Again, if you're by yourself, there's no need to type anything at this time. Again, note that individuals who are signed in will receive the certificate of attendance. However, if you are viewing with an additional person, you will need to download the group validation form in order for that additional person to receive their certificate for today's webinar. That being said, I'd like to turn it over to our moderator, Sally Kerr, for today's webinar. Sally, take it away. Oh, Sally, you're on mute, by the way.
Thank you. Welcome everyone to the Trauma-Informed Care and Practice in a CAC Setting webinar series that is being produced by the Western Regional Children's Advocacy Center. I am Sally Kerr, a state liaison with Western Regional CAC, and I'm a provider of technical assistance and training within the Western region of the United States. Western Regional CAC is committed to supporting communities and tribes to develop and enhance multidisciplinary teams and local programs such as children's advocacy centers to allow us to better respond to children that have experienced abuse and neglect, and to deliver training and technical assistance and support by strengthening existing investigative MDTs, CACs, and the state chapters of the National Children's Alliance in the 13 Western states. This webinar is being supported by OJJDP and being hosted by NTAC, as you know, and we are thankful for their support as they have helped us host this webinar series. Welcome to the series of 3 webinars for professionals working with children's advocacy centers. This series will examine, the first webinar examines a trauma-informed approach to investigating child abuse allegations and responding to child victims. That is available on the NTAC YouTube channel that William referenced earlier. The third of the series will examine the use of a trauma-informed organizational assessment tool to inform changes a CAC can implement to improve staff and skills provided to children and families. And this series, this webinar, the second in the series, will focus on helping professionals working in and with CACs to understand and determine how to incorporate trauma-informed practices and skills for staff and organizational systems. With that, I would like to introduce our presenter, Melissa Bernstein. She's a licensed clinical psychologist and is currently the co-director of the Advancing California Trauma-Informed Systems, the ACTS project, and Trauma-Informed Licensing Team, the TILT project, both within the Chadwick Center at the Rady Children's Hospital in San Diego. She previously served as an assistant professor at the OU College of Medicine in the Department of Psychiatry and as a psychologist at the Center on Child Abuse and Neglect at the University of Oklahoma Health Sciences Center. As a psychologist working with children, youth, and families impacted by traumatic stress, Dr. Bernstein has developed expertise in understanding child maltreatment and utilizing evidence-based practices at an individual, family, and system level, including trauma-informed cognitive behavioral therapy and cognitive behavioral therapy for youth with problematic sexual behavior. She joined the Chadwick Center for Children and Families in 2018 to support systems and organizations in planning for, implementing, and sustaining trauma-informed change that aligns with best practices in science. So welcome, Melissa. We're excited to have you with us today.
Thanks so much, Sally. Hi, everyone. I'm really excited to be here with you all today. So like Sally mentioned, and Sally, I think my video is going to stay on for this part, or are we good?
That's great.
Okay. Great, okay. So thinking about this presentation on trauma-informed care, Sally mentioned that this is the second webinar in a 3-part series. So we are right in the middle. And it just so happens I was listening to a podcast this morning from Brene Brown, who was absolutely wonderful. But she was talking about the middle of things and what it's like to be in this space, to be kind of in the middle. And she talked about how the middle is a bit messy, but where the magic happens. And that's a bit how I think about trauma-informed care system change, the topic that we're going to be talking about today. So we're kind of in this middle stage. We know about trauma. We know it's widespread. We know its impact. We know it can't be ignored, right? That die has been cast. We're moving forward. And now we're kind of at this middle point where there's not really gold standards about how to move forward, but we know we have to. We're maybe a bit unsure. Maybe we have to be vulnerable. We don't necessarily see the light yet, but we know it's there. And kind of this is where all the good change happens. So I'm excited to be here in this kind of middle space with you all today to talk about trauma-informed change. Okay. So for our time together today, this is our agenda. We're just going to start off by talking about just a little bit about what we mean by trauma-informed care, and then spend the majority of our time talking about those key elements of a trauma-informed system. So what does it look like to be trauma-informed? What does it feel like to be trauma-informed? And then spend a little time at the end talking about how do we create that trauma-informed change. So I know in this era of 2020, you guys are probably on many webinars, many Zooms, many electronic platforms. So we do try and want to make this as interactive as possible. So there will be a couple of polls and chats that we'll get to engage in to hopefully keep this engaging for you all. All right, so to start us off, I noticed it was super fun to watch you guys pour into the room and see all the different places that you guys are coming from. I'd love to get a sense of who's on the call. I know that there is many disciplines represented here today. So if you guys could just go ahead and fill out that poll that probably is popping up on your screen, we can get a sense of who's in the kind of proverbial room here today. All right, so as that's coming in, we see quite a bit of victim advocates, child protective services, a lot of other. I wish we were face-to-face so I could ask you guys what that is. Some mental health providers, some CAC staff, some law enforcement on the call today. Great. Some folks from prosecution, forensic interviewing. So a little bit of everything, it looks like. Wonderful. Great. Okay, we can go ahead and close that poll. Thank you guys so much for doing that. Yeah, so there's a lot of different organizations represented here today. You know, when we're thinking about trauma-informed care practices and implementing those practices, you know, they're obviously going to vary depending on your organization, but the principles of trauma-informed care, which we're going to be talking about, are generalizable. So that's really what we're going to be diving into today. Okay. So the next thing I want to do, kind of before we dive into the heart of things, is if you guys would engage me in just two really brief, short poll questions. So the first one is, trauma often comes up in my work with children and families. So just yes or no. I see really quickly that a lot of votes are coming in. So far, we're seeing overwhelmingly 96% of you that trauma often comes up in my work with children and families. Great. All right, then we can go ahead and close that poll. So for the next question, I feel very confident that my organization is trauma-informed. Give it another minute or two for folks to answer that question. Okay, and if we can go ahead and broadcast those results. Great. So I've done this activity before, and while I think a lot of things are shifting, this is pretty typical of the response that we get from lots of different organizations and lots of different audiences that work with kids and families exposed to trauma. So overwhelming majority of us know that trauma comes up in the work that we do, right? 96%. But not a majority, well, a majority, that's true, but not all of us are feeling very confident that my organization is trauma-informed. And, you know, I think we are at a point as a field where we're recognizing the impact of trauma on kids and families and on us as helping professionals as well. You know, it's very rare that I come across any leader, any helping professional who's like, no thanks, I'm just not interested in addressing the impacts of trauma. Moreover, it's more that maybe I just don't have the tools to do that, or I'm not even sure what trauma-informed care looks like. And I think that's pretty fair. Trauma-informed is such an umbrella term, and we really don't have standards yet, while we're moving in that right direction. So I'm excited to talk about how we're beginning to do this, but I also wanted to just do this quick kind of poll to highlight that this is also kind of relatively new at an organizational level. And so doing this work and bringing trauma-informed system change to your organizations are quite pioneering. All right, and we can go ahead to the next slide. Right. Okay. So as we're going to kind of get into this work, I just wanted us to think about what experiences do you want traumatized families to have when working with you? And this is just kind of a point of reflection for you all, thinking about, you know, in your work with children, youth, and families, what kind of experiences, what do you want them to feel when working with you all? And just to keep kind of that in mind, whether you want to write that down, and just keep that in mind as we kind of go through this presentation today. Okay, so now to the heart of it. What do we mean when we say trauma-informed care? So the idea of trauma-informed systems really sprang from research on the efficacy of trauma-focused interventions for children and families. So we're seeing a lot of success when we recognize trauma and its impacts, right? So for a lot of kids, trauma can be really an organizing principle. It's how they see themselves, right? It's maybe how they see others, maybe not trustworthy, and how they see the world around them. And we're learning as a field that this is something that can't be ignored. So a trauma-informed organization there's a couple different definitions out there, but this is one that's probably the most frequently cited. So we're going to go with this, and this is by SAMHSA, the Substance Abuse and Mental Health Services Administration. So a trauma-informed organization is one that, one, realizes the widespread impact of trauma and understands that there's pathways for recovery. Two, a trauma-informed organization recognizes the signs and symptoms of trauma in clients, families, staff, so us, and others involved in the system. And then three, responds by fully integrating knowledge about trauma into policies, procedures, and practices. So these are kind of the 3 R's, if you will, of a trauma-informed organization. And, you know, I think we're doing a really good job with starting with those 2 R's, realizing the widespread impact, especially from the Adverse Childhood Experiences study and that movement. And we're doing a good job recognizing signs and symptoms of trauma. There's more trainings, there's more webinars, there's more presentations. But really this 3rd R is kind of where we're at now. How do we respond now as organizations? How do we fully integrate all of these information that we have into our policies, procedures, and practices? So that's what we're going to be focusing on today. Okay, so this next slide is really, why do we want to address trauma-informed care? What's the point, right? What are all these initiatives and effort about? And really when we step back and we think about it, the goal is really to improve those client services and that client experience. There was a recent meta-analysis that came out just last year in 2019 that looked at outcomes from organizations that implemented trauma-informed care in their organizations. And we're starting to see some preliminary evidence that engaging in trauma-informed care in a system can really serve to improve the quality of services to families and that client experience. We also often see, especially in the work that I do, Sally mentioned with, I work with child welfare organizations to implement trauma-informed change, and also the world of licensing, that we see a big shift just in the organizational culture in general. So that increase in satisfaction, right? That organizational wellness, and really wanting to create a community of hope, healing, and recovery. Okay, so now we're gonna, that's kind of a little bit of a definition, operationalizing what we're talking about when we're talking about a trauma-informed system. But now I really kind of want to get into what are those key elements. There were a lot of wonderful questions that were asked when you guys registered. I really appreciated that. I thought that was really great. And a lot of the questions were focused on how do we know if we're trauma informed? What practically can we do to move our organization in this direction? And so hopefully by going over some of these key elements and some examples, we'll kind of get more of a practical sense of what this looks like. Right. So to help us navigate this path, I wanted to start with this visual that the program that I co-direct created. So it was really influenced by this article in 2016 by Hansen and Lang. That it was a really great article. They reviewed the literature on trauma-informed care. They looked at articles that had data, and they organized all the key elements of a trauma-informed care system. And they organized them into these kind of 3 buckets, if you will. And so you see here on your screen, we have the organizational environment, right? So thinking about the environment of your organization. Those are things like system collaboration, physical and psychological safety, partnering with children and families, our policies and procedures, and culture and diversity and trauma and that intersection. Then we have this second bucket of workforce development, right? Thinking about how we're training our workforce. And those are things like trauma training and secondary traumatic stress. And then the third bucket, when we're thinking about trauma-informed elements within our organizations, we're thinking about the trauma-informed services that we provide. Now, not all organizations will have all of these, but these are things like screening, trauma-informed assessment, referral practices to trauma-informed evidence-based treatment, and then those services within our organizations to promote growth, well-being, and resilience. So my first thought when I see this is a bit overwhelming. There's a lot here when we're talking about trauma-informed care. But as we go through these different elements one by one, I want you to start thinking about what you guys all already do, because I bet you do a lot of these things already. Maybe we just haven't given it that trauma-informed language yet. Okay, so we are going to start with the organizational environment and focusing on some of the key elements within the system. Okay, so the first, I think, and fitting for this group of folks is system collaboration. I think you guys probably know more than most that many children and families that are affected by trauma are served by multiple systems, such as child welfare, schools, law enforcement, basically all of you guys on this call, right? And so these systems, all of our organizations, have individual mandates, priorities, demands that really impact how we intervene with kids and families. So trauma-informed cross-system partnerships really involve collaboration, service coordination, information sharing among all these different professionals. There was a study that was done that looked at some of the factors that are known to promote cross-system collaboration. And so I thought that was pertinent to share with you all today. So those were things like we have a history of working well together and a history of trust. We've got clear roles and responsibilities. So I know in this collaboration what my role is. I know what their roles is, and I know my responsibility. That we're communicating openly with each other, and that there's proper consent in place so that regular information sharing can take place on case plans. And that regular attended joint meetings are held to determine the needs of family. So you guys are already really hitting this mark with trauma-informed care and system collaboration. MDTs are a wonderful example of system collaboration and really such a key element of trauma-informed care. So this is really just kind of one of those reflection questions that I'd like you just to take a moment and think about. So thinking about the factors that I just mentioned, communication, information sharing, trust, if you could just think about where are the gaps? Where are the gaps in my organization that maybe limit or serve as barriers to that good system collaboration? What might I want to take out of this presentation when I'm thinking about, we know system collaboration is such an important part of trauma-informed care, and we know what are some of the variables that lead to success. What might be some of the barriers that are preventing that successful collaboration? And I invite you guys to just think about that, or if you're so called to do, to write that down on a piece of paper so that you can reflect on that later as well. Okay, and I'm going to pass this point of reflection. Oops, nope, we're not there yet. So, okay, so we know about system collaboration is important. Now what do we do? How can we advance that in our organization? So one way is really being knowledgeable about the major voices for kids and youth exposed to trauma in your community, and having those working relationships with these systems. So knowing those folks' names, knowing their numbers, making sure that there's a relationship there. I think when we're talking about trauma-informed, a lot of the time we're talking about relationships and building those strong foundational relationships. Are there procedures in place for sharing pertinent information and data to those outside and within your organization? It's easier said than done, right? A lot of the times that might take some leadership to be involved in that change. And then lastly, having cross-built systems or multidisciplinary training to familiarize providers with other systems, which I think is so important. We all have our own language that we speak, right? We all have our own acronyms, and we have plenty of them. And so learning about other systems and just feeling more familiar and more connected to them can be so important. I know when I was in, Sally mentioned that I was in Oklahoma before being here in California, where I'm at now. I participated in something called an interdisciplinary training program, where I got to be in a class with law enforcement and medical professionals and public health experts. And it was so eye-opening to just learn about all of these other wonderful systems that are working with children and families that have experienced abuse and neglect. Okay. All right, so we're going to move on to the next element of trauma-informed care within our organizations. So we're going to be talking about physical and psychological safety. And I wonder, I don't think this is a poll question, so I'll just ask you guys to reflect this for a second. When you hear the word safety, what comes to mind for you? Just thinking about a sense of safety. What are some of the words or thoughts that come to mind? When we think about psychological safety and physical safety, we can think about it as a way that really, what it really does is facilitate emotion regulation. And it creates an environment of trust, and it helps kids and families to really be present and engaged in our services. So safety is so important when we're talking about working with kids and families in our organization. It's a construct that's really lacking in a traumatized kids environment. So children who have experienced trauma, they may have really valid fears about their own safety or the safety of their loved ones, right? They may have difficulty trusting adults to protect them. They might be hyper aware of potential threats, right? And have problems controlling their emotions to those perceived threats. And so when we're thinking about, okay, is my organization trauma informed, we're really thinking about how does my organization create a sense of physical and psychological safety for the kids and families that we serve. Okay, I'm going to skip over this one. So, oh, no, I'm not. We're going to do that one. Okay, so thinking about a little bit about safety, where in the system might a child feel maybe physically safe, but might not psychologically safe? And this isn't a softball question. I think this is kind of a hard question, so I'm really interested to see what you guys write in. So again, where in the system might children feel physically safe, but maybe not psychologically safe? Some of the things that I'm hearing from you all are a hospital, in foster care, right, in a worker's office, with a counselor, at court, in a new placement. Absolutely. So other answers are things like a therapist or counselor's office, the school. A lot of answers we're seeing in a foster home, absolutely. In a new placement, detention centers. Maybe in the actual child welfare office itself. These are really interesting responses. So it seems like anywhere, really in a lot of these different environments. It can feel maybe that it's a physical safe environment, but we have to be mindful that given the experience that these children and families have had in their lives, that they might not be feeling psychologically safe. So what can we do about this? We're just going to go ahead and move on to that next slide. So how do we advance physical and psychological safety for the kids and families that we serve? One is thinking about the environment that we're in and how it can promote that sense of calming and de-escalation. So, they can be simple things like the initial greeting. What do kids and families see when they first arrive? Are there welcome signs? Can we orient them to the space, right? So I know when I worked in a trauma clinic, we would walk kiddos around the office just to show them where the exits are, where the rooms are. This is where your room will be. Just giving them a kind of a feel of the space. Some spaces there's going to be security guards, right? And that's going to be needed and quite essential. But how can we balance that? Maybe how can we let kids know that when they come to this facility, this is what they're going to be seeing. This is the purpose of what they might see. Right? If we're thinking about kids and families with trauma, they don't really like surprises or change. So the more we can create that welcoming environment and also prepare the kiddos and families to what they might be experiencing, that can be really helpful. That physical environment, so things like, is there artwork on the walls? Are there consumer rights posted? And is that reviewed with kids and families that come into your organization? Sounds are really important when we're thinking about kids with trauma too. So again, sometimes we can't avoid those loud intercom systems or those slamming doors, but maybe when we sit down with those kids and families, we can let them know that this is something that they might expect. And that transparency and that communication, that's really what encourages that sense of safety. We also want to think about safety for our staff members too, right? Having that physical safety and crisis protocols in place. Are there those alarm buttons in the desk maybe? If they're going out in a really difficult case, can they bring a partner with them? So thinking about psychological and physical safety, not just for the families that we serve, but for ourselves as well. Okay, so we're kind of rolling through these. So we're going to go on to our next kind of key element of what do we mean when we're talking about a trauma-informed system. So we've talked about system collaboration. We've talked about the importance of physical and psychological safety. And so I want to talk about the importance of partnering with children, youth, and families. So this came up in one of the questions that was submitted, and I just loved this question. The question was, why are we not listening to the voices of children? I thought that was just such a strong, succinct question, because we really need to be, right? Partnering and the authentic partnerships really begin with acknowledging and appreciating the unique experience and expertise that the children, youth, and families involved in our systems have. And so this is really quite a critical element of being in a trauma-informed care system. Okay, so when we're thinking about partnering and creating authentic partnerships, and we'll talk a little bit about that on the next slide, a piece of that is really engaging children and families in the services that we provide, right? We want them to be engaged so that we can partner with them. And there are a couple barriers to engagement that I just wanted to highlight for you all. These barriers can really reside anywhere within the family, within the provider, and just within the system too. And so the literature on kind of barriers to engagement, which has really been pioneered by Mary McKay and her colleagues in her work, kind of break it down into two buckets. If you can't tell, I really like organizing things into categories. So we have concrete obstacles to engagement, so things like time, which is huge for everyone, right? Our competing priorities, transportation, I can't get to your organization, childcare, right? These are concrete barriers that really limit engagement of the children and families we're trying to serve. The other area are those perceptual obstacles. So things like attitudes. I don't think this is going to be helpful. Stigma. I've had really negative experiences with this system before. And then parents' own stress and their own needs. Okay, we're going to open up this really quick poll question for you all. When you're thinking about barriers to engagement, which do you think are the barriers that are kind of most important, the ones that really get in the way the most, or ones that really lead to disengagement? Is it those concrete barriers, so that time, the transportation, childcare, competing priorities, or is it those perceptual obstacles, the attitudes about the services you're providing, their past experiences with those services, the stigma that's associated with potentially some of those services? So I'll just give it a second to let those answers roll in. Thank you guys for participating in these polls. I think it helps to keep us engaged if we can't see each other's faces. Let's put a couple more. They're trickling in. Thank you guys. Okay, I think it's pretty holding steady, so we can go ahead and broadcast that poll. So you guys are on the money here. Yeah, so 75% of you said it's those perceptual obstacles. I know when I was first starting to hear about this, I was a bit taken aback by that because I spent so much time on those concrete obstacles, which are obstacles and are important. But really, what the research has shown is that it's really those perceptual barriers that are most related to disengagement. And so we really want to think about spending time with our children and families at the very start. What are their perceptions about the services that we're offering? What are their attitudes towards our services? What have their experiences been in the past with these services? And it might take a little bit of time, in the beginning, but really saves a lot of time in the end to really have those children and those families be heard. And what we know from the literature and probably just from our own kind of common sense here is that it really helps with that sense of engagement. All right, so we can go ahead to that next slide. Great. Okay, so when we're thinking about, we know this is important, now what can we do about it? How do we advance these partnerships with children, youth, and families? So one way is to really strengthen the experience of choice. We talked about safety before as being one thing that's really kind of stripped away from kids and families who experience trauma. Control is one of those other things that are really stripped away. And so the more opportunities for choice we can give the families that we're interacting with, the better. So how much choice does each consumer have over what services they receive, when they receive them, where they receive them, by whom they receive them? A lot of those things probably maybe we can't alter. Some of them maybe we can, so that's interesting to think about. But maybe what are those other small choices that can make a difference? So things like, how would you like to be contacted? When would you like to be contacted? Where would you like to sit? Do you prefer to write answers or talk out loud? So all of these little kinds of choice points, the more often we can give children and families these choice points, the more control we can try and give back. Another way to advance partnerships with children, youth, and families are valuing that relationship to creating shared goals and transparency. I'm sure this is something you guys already do in those in your MDT teams, but making goals together, right? Creating goals so that the goals are reflective of that client's voice. And then lastly, thinking about policy decisions that are conducted with transparency and collaboration. So things like parent partnership boards are really awesome to kind of review policy. I'll do a little shout out to Larry County Child Welfare, who I've worked with. They were really looking at placement stability as one of their trauma-informed kind of goals and initiatives. And so what they ended up doing was calling families. They first set up a database to track families who were giving 14-day notices. And then they called those families to get feedback from those caregivers about what could we have done to help? Is there anything we could have done to help? And they based that feedback and that collaboration with those caregivers on the interventions that they then created. That's just a quick example there. Okay. So let's move on to the next one. This is organizational policies and procedures. And I know we're moving through a lot of these, and I'm giving a lot of information here, so I just want to let you guys know, too, that we'll have some time at the end for questions and answers. Okay, so organizational policies and practices. This is another key element of a trauma-informed system. This one is really critical, not just to creating that trauma-informed change, but to really making that change stick, to really having change that's sustainable over time. So what are we talking about here? We're talking about things like, for practices and policies, all new hires will receive training on trauma and STS, or One of the organizations I've worked with created a supervision policy to make sure and operationalize how often supervision occurs, and we worked on having reflective practice be part of that conversation. So those are things that, again, will last beyond just an external source maybe coming in. Those are things that are going to last because they're policies and practices in the organization. So when we're talking about these things, we're often talking about working with leadership. Senior leaders are really, really key in being involved in this work, and we'll talk a little bit more about that later. So leadership is really important, but some organizations also identify champions that can really help to push this policy work forward. And these are probably just folks like you and me that are dedicated to trauma-informed care, that are interested in learning about trauma-informed care, that value this and that want to bring it to their organization. Okay, so I'm going to turn it over to Sally.
And so we have, as reflection questions asked, who can you identify as a champion to support your own system organizational change? You can type your answer, not necessarily someone's name maybe, but by their position or who you could turn to become a champion for support. And then in the other question is, in what ways can you engage your senior leadership in the discipline that you're in to provide guidance and support in change initiatives? And so, as Melissa mentioned, leadership, to start to think about and reflect who you can go to for support in that change initiative. And we did leave these up so you could see the results of the kind of champions people will be turning to talk about organizational change. We see a lot of great responses in the ways that you can engage, from creating accountability to team meetings and collaborative meetings, to trainings and focus groups. There's ways that you can start to think about how that engagement starts.
Yeah, I love what some of the answers that are coming in. For that first question, who can you identify as champions? I see a lot on the supervisor level, director level, absolutely a lot of managers. Myself, amazing, great. We are actually all champions. The sheriff, and you know, in this work, oftentimes when we're doing trauma-informed care work, we think, okay, let's focus on the line staff because those are the folks that are most closely, you know, having experience with the children and families that have been traumatized. But I just love these answers. I think it really speaks to the importance, and what we found to be most important is that we really have to engage the whole organization. It is kind of top down here. It's the leadership, it's the supervisors, it's the managers that can really open the space up to create that change. So I love these answers. I think that's so important. And then for the second question here, in what ways can you engage your leadership? I see a lot of training, which is absolutely true. We'll talk a little bit more in the presentation about trainings and some strategies to help those be successful. But I also see things like team meetings, focus groups, conferences. Yeah, sharing data. It can be little things too, right? So with trauma-informed care, we can have these large system changes and maybe these statewide initiatives and these large changes that are going to have to include leadership. But we can also just start talking about this in our day-to-day interactions within our organization. So I really love the answers that you guys are providing here.
Mm-hmm. And I think we can end those.
Perfect. There we go. I think we're one button. Let me can do this. There we go. Okay. So thinking about how do we, what are some ways maybe that we can advance some of these organizational policies? I think you guys had great ideas in terms of trainings and meetings and just communicating with each other. So I'm just going to throw a couple more out there. So one thing that we find to be really, really helpful, because we know all the organizations we work in, there's a lot going on. There's a lot of initiatives. There's a lot of change that's happening. And there's also a lot of turnover. And so, how do we make this stuff stick? So identifying a point of responsibility within the organization that is kind of invested and engaged in trauma-informed administrative practices can be so helpful. I mean, sometimes, this is definitely having those resources created a full-time FTE or at least part-time, but we've definitely found that having that identified point of responsibility can be really useful. Policies and protocols for workforce orientation, training, and support, so you guys already hit that. Doing a bit of an organizational self-assessment can also help. So where do we want to focus? There's a lot here to do. And so just looking at that menu that I shared earlier, where in my organization do we want to start? Maybe we're already doing a lot of work on system collaboration and physical and psychological safety. Maybe we want to think about policies and practices for secondary trauma or for screening. And then you guys also touched on this, but that senior leadership and how important that is. Great. Okay, so the next kind of key element, again, when we're thinking about, is my organization trauma-informed? How do I create a trauma-informed organization? Another key element is culture and culture diversity and training. And I'm just going to start out by saying there is no way, I'm going to talk about this for a couple minutes, but there's no way I'm going to be able to give this area justice in the little time that we have. This is usually a full presentation, but I did want to make sure that we mention it and we talk a little bit about it here, because understanding the role of cultural and historical trauma and current social and cultural realities and how they strongly influence children's risk for and experience of trauma, and how we understand this and how we're attuned to this is really such a critical part of being trauma-informed. So really understanding how trauma affects children, youth, and families, we really have to first understand how their life experiences, their cultural backgrounds, serve as a contextual element for trauma and also for resilience. Okay. So when we're thinking about how do we advance this in our organizations, a great place to start is that training and that workforce knowledge and awareness. That awareness and knowledge about how culture influences the interpretation and meaning of traumatic events for our kids and families, and the acceptability of support and their help-seeking behaviors. And how do we incorporate this intention to culture and trauma in our organizations and in our quality improvement processes? Right, we think about having, I think when we talk about trauma-informed, we often hear the word lens or hat, right? We want to put on our trauma-informed hat, we want to put on our trauma-informed lens. We have all this knowledge about trauma and its impacts and how the children and families that we're working with might react or respond to me based on their trauma exposure. We want to also have that cultural lens as well. And I'd argue that it's really hard to disentangle these lenses, to have one or the other, that they really kind of go hand in hand. Okay. So that was organizational environment. So thinking about my organizational environment, is it trauma-informed, system collaboration, physical and psychological safety, partnering, policies, culture. Those are all the things we're thinking about when we're thinking about a trauma-informed organization. So we're going to move on ahead now and focus on workforce development. So things like trauma training and awareness and secondary traumatic stress. Okay. So I've heard in some of the poll answers that you guys have had, and I'm sure I know we talked a little bit about this earlier, but the importance of training in trauma. And so knowledge about traumatic stress is really a critical first step for staff to effectively understand and support and serve those impacted by trauma. One of the questions that you guys asked when you guys were registering was, where do we start? Where do we begin? A good self-assessment is helpful, but also, if you're thinking about, we're pretty new on this trauma-informed journey. We haven't really done a lot of work in this area, thinking about all these elements. training is a really great place to start. And I will just say that it really is a journey, no matter how corny this sounds. Trauma-informed care and all of this work that we're talking about together today, it really is a journey, not a destination. It's not something that we can kind of check off and say, okay, I attended this training, I'm trauma-informed, right? It's the same thing with culture. We can't attend a talk about cultural humility and say, great, I'm culturally competent, work is done. It's really something that we dedicate ourselves to and something that we dedicate our organizations to. So no matter where you are on this journey, as an organization or as an individual, that is okay. Whether your organization has done a lot of this work and now you're thinking about, how can we really advance it? Or whether you're on this call and you're thinking, we really haven't done much of this, where do I begin? All of that, I think, is perfectly reasonable given that, again, like I said in the beginning, some of this work is quite pioneering in organizations and systems that serve children. Okay. So I don't want to be hypocritical. I hope I'm not talking out of both sides of my mouth here, but I also want to say that training on its own is often ineffective in creating the change that we really want to see. And so training that can be most effective, and we'll talk a little bit more about this, is coupled with thoughtful organizational change, leadership involvement, really to make sure implementation work, to make sure that that knowledge is translated into practice. So I just see an audience question here that I think is really fitting. So what trainings do you recommend? So one, trainings like this, trainings on trauma-informed care. There are really great, I'll plug this at the end too, but the National Child Traumatic Stress Network is a wonderful resource, and they have a lot of trainings on trauma. They have info trainings, they have advanced trainings, and they also have trainings, and again, these are more kind of like presentations that you can kind of go through, but they've got great information on there and PowerPoints on there for different audiences as well, so that's something I definitely highlight. And as we move on in the presentation, Joyce, there's some other organizations that I'll highlight as well. Okay. So just a quick poll question. Have you ever attended a training on trauma? Yes or no? Nice, quick answers. Okay. Looks like we're holding steady here. Everyone, great, not surprising. There's a lot of trainings out there, right? And I think absolutely it's so critical. It's a key element of being trauma-informed. That's where it starts. That's kind of the meat and potatoes, right? Is being knowledgeable about trauma, the impacts of trauma, not only on ourselves, not only on children and families, but on ourselves too. But I do want to highlight, we can go ahead and close this slide and move on to the next slide. So given that we're talking about organizational change here, I do want to just bring us attention to what are some ways that we can make training the most effective. Again, you guys asked great questions. One of those questions were, what are ways that we can ensure our workers are adequately trained on trauma? So having trauma training available at your organization is the first step. But we also want organizations to show support and commitment to that training and to that awareness. So things like allowing time out of staff schedule to attend the training, that sends a big message, right? This training maybe isn't during lunchtime. It's during a time where I'm saying, this is important, I want you to attend this training. Having systems in place to monitor the impact of that training. So things like surveys or follow-up, using supervision as a way to kind of follow up on those trainings. Hey, we learned this great skill in this training. How's that been going? Have you been using it? Coaching to support training. Again, that one requires some resources, but that can be really helpful. And then I'd urge, when you're thinking about bringing in training to your organization, do we have the internal capacity to ensure that this can be ongoing? So oftentimes, I'm a trainer myself. I'll ask if there are any internal trainers in the organization that I could co-lead with so that that training really lives within that organization. Or, this training will be available. It's being recorded. It can be shared. Making sure that maybe there are champions that can take on that so that this information lives within your organization. Okay. Let's see how we're doing on time. Okay, we're good. So right on time. And I say that because I can spend a lot of time on this area. Again, I know this is a lot of information, so I'll just let you guys know we're almost towards the end of these key elements. I know it's a lot. There's a lot here. So thinking about secondary traumatic stress and addressing secondary traumatic stress is another kind of key element when you're thinking about your workforce. So I'm thinking, is my workforce trauma informed? The first question is, do they have that knowledge and training and awareness on trauma and its impacts like we just talked about? The second is, do they have that knowledge and awareness on how that trauma might impact them? So we know that a stronger and more resilient organization is one that supports and strengthens those exposed to the first-hand emotional duress of another. So I think there's a way that we used to think about this, and probably maybe to some extent still do, which is becoming numb is good. Like, I'm not affected by this. Let's just suck it up. This is part of the job. Feelings about the work, they're not really welcomed here. And really, feelings are a sign of weakness. There's a lot to do here. We gotta get through it. We gotta suck it up and move along. And I want to just urge us on this call just to think about, we cannot walk through the water without getting wet. And if we don't have this attitude, if we think that we won't be touched by this work, that can be really harmful. In the organizations that you all said you're a part of, we do see really high turnover rates, right? We see high rates of burnout. We see high levels of stress. It impacts our ability to do the work to the best of our ability. And so there is a need to address the emotional impact of this work so we can better serve our children and families. So how can we do this? Actually, before we get in there, I just want to do a little activity. So these are some of the kind of signs and symptoms of secondary traumatic stress. And for the purposes of this call, what I mean by that, because I imagine some folks, maybe this is the first time that you've heard that term. For others, you might be more familiar. We're really talking about the emotional impact of the work that we do, right? And so I'll give you guys a second just to look at this screen and to just take in some of these symptoms. Okay. So if we can go ahead and open that next poll. So no names here, obviously just a yes or no, very anonymous. I've experienced at least 3 of the signs or symptoms of secondary trauma that were just posted before. So again, those are things like avoidance, really feeling preoccupied, having some intrusive thoughts, feeling kind of strange or isolated. Maybe sometimes we don't really want to talk to anyone else, difficulty separating work from our personal lives. And I'll let you guys just take a minute to answer this question. Great. Looks like we're holding somewhat steady. Oh, nope. Moving around here. All right. I think it's around, I would say 70-30 seems to be the response that we're getting from the group. One, I really appreciate everyone participating in that poll and just taking some time to reflect on your own experiences and your own engagement with your organizations and with child trauma. We can go ahead and move on to that next slide if that's okay. I do this activity not to say, wow, look, almost 70% of us on this call from people from all over and all different organizations experience secondary traumatic stress, and that's a really bad thing. I don't think so. I think what I'd like to do is highlight just how normal that is, how normal it is to have those experiences when you're in this field, and just to validate that this is an experience that a lot of us have and that it affects our work and that it's really worth addressing and really worth taking the time in our organizations to have the space to learn about secondary trauma and its impact on us and ways in which we can reduce that as a workforce. I really see this as quite a critical piece of trauma-informed care. So with that, I'm going to pass it back over to Sally.
Thank you. So you see the questions, and we can start the short answer poll that would allow us to write in some brief answers. In what ways does your MDT engage the team in recognizing signs of traumatic stress, secondary traumatic stress? Like within members of the team, how do we recognize those signs? And does your team routinely include discussions about the effect of the work on the members of the MDT? Let some answers come in. So not yet being one of the answers to including discussion. So when we're at the in what way, we see a lot of opening up a meeting, we talk about it. If somebody appears to be struggling, pulling them aside and talking to them. An occasional email about self-care. Check-ins with one another. And then as we've answered the questions, does your team routinely include discussions about the effect of this work? We could consider too, in what ways could some disciplines within the MDT be affected differently than other team members in that same MDT?
Mm-hmm. Great. I'm also noticing. Sorry, Sally, go for it. Sorry.
I like the discussing self-care as an icebreaker, and we've used that pretty successfully as we talk with teams.
I see no, and at the peril of clients we serve. That's quite
right.
Absolutely.
Right, very strong statement.
Mm-hmm.
And some of that standardized debriefing opportunities, sort of that reflective supervision process.
Mm-hmm. Great.
Okay, I think we've probably gotten quite a few answers and can go back to the slide. Have Melissa talk about advancing these causes.
Thanks, Sally. Thank you. And I do want to just reflect on some of those answers. There were some yeses and a lot of no's. While this work is so important, I also recognize that in some of our organizations, this is a big change. This is maybe not the way we've operated before, and it could be a real culture shift. And it could take a lot of vulnerability to move folks in that direction. For some of us, maybe this comes quite naturally to be able to think about our emotions and how working with children and trauma and hearing these stories and either reading or seeing this work can impact our emotions and talking about that and being attuned to that. For others, that is very new and not the way that they've engaged in the organization before. And so I think this is where leadership, supervisors, managers, directors can really come into play here because they're going to be the ones in the organization that need to open up that space for vulnerability. I've seen this a lot. We do a lot of this work with our child welfare organizations. And where we see the most shift is when a leader, an executive leadership or a manager really opens up that space to say, this is a safe space to do this. It's not going to be punitive. And it really allows permission for other folks to follow suit. So when we're talking about advancing secondary traumatic stress, thinking about really the importance of leaders kind of modeling that change. Some other ways that we can advance secondary trauma, obviously trainings or workshops, understanding the impact of secondary trauma. We don't have time to go into this in detail, but reflective supervision. So in supervision, asking, not just maybe about that case management stuff, but how did it feel when you had to remove that kiddo from their parents? Our organizations to provide those resources for self-care. So not just saying to take that time at night, engage in self-care, but really providing some of those resources. So that could be supervision, consultation, peer support, and then procedures that are sensitive to the impact of trauma on the workforce. Okay, we are going to move into the last area, and we're not going to go into detail like we've been doing with some of those other key elements, because not all of these elements, I think, relate to everyone on the call, but I do want to just highlight some of these and talk about them. So again, a trauma-informed organization is one that has and provides trauma-informed services to some extent that it fits your organization. Okay. So enhancing child well-being and resilience, when we're talking about treatment and services, one way to really enhance resilience is to ensure that children have access to evidence-based treatment. We know that treatment can help the child reduce overwhelming emotions related to the trauma, cope with trauma triggers, and make new meaning of his or her trauma history and experience. So again, we don't have time to go into all the different evidence-based trauma treatments. We know that they're really successful, and we want to know what those are, whether we provide those or whether we're referring folks to treatment. And so I'll give a plug here to the California Evidence-Based Clearinghouse. It's for child welfare, but it's very applicable to other organizations as well. It's very user-friendly information on evidence-based practices, and they have scientific ratings and relevance for their interventions. So say, for example, a family tells you, hey, we're participating in this treatment. You can go ahead, type it in, the CDC, and see what the rating is, whether that is a well-established treatment that is well supported by the literature, or whether there's not really support for the literature for that to be an impactful or an evidence-based treatment. So this is a really nice resource when we're trying to just educate ourselves around evidence-based treatments for trauma. Okay. I also wanted to highlight just some of the core components of trauma-focused evidence-based treatments. They have a strong therapeutic relationship. There's psychoeducation about trauma. Parents are always involved. There's conjoint therapy. And the work that that kiddo and that family is doing is around emotional expression, anxiety management maybe, and most importantly, that they're talking about that trauma, that they're processing that trauma. So again, when we're thinking of system collaboration and we're talking about learning about others, other systems that maybe provide these services or that refer to these services, these are some kind of helpful kind of talking points when we're thinking about evidence-based treatments and evidence-based practices. Okay. All right, so in the little bit of time we have left, we've got a couple more minutes because I want to make sure we've got time for some questions and answers. I just want to switch gears a little bit here and talk about how do we create this trauma-informed change. I think you guys, in our poll and chat conversations, we've hit some of these already. But I just want to give a little bit of an overview about some of those implementation kind of pieces that once we've decided that we want to work on these elements, that can really help to make that change sustained and to make that change successful. Okay, so the first is we need the ingredients. So before we're diving into this trauma-informed work, it's important to check with your organization and to see if you have the ingredients or the prerequisites needed to make this meaningful change. And so what I mean by those ingredients are things like time. Do we have the time to work on this? Do we have the resources? Do we have the capacity? Are we operating with a lot of vacancies? Maybe this isn't the best time to engage in some of these initiatives. And really importantly, do we have the motivation? And where is that motivation? I think that that's so important in thinking about where we want to start this work. Rather than, right now, I don't think we're at a place where the literature can tell you your best bet is to start here and then do this and then do that, right? I think we're at a point where it's really a process of thinking about what has my organization done? Where does my organization want to go? Where's the motivation in my organization? Maybe what's in my system improvement plan? Just real practical things to think about where we can start this work. Okay. Another key ingredient that we've talked about a lot, but I really don't, my belief is we can never talk about it enough, is the importance of leadership, support, and buy-in for this work. It really, truly does make all the difference. You know, in the different types of organizations that we're all a part of, there's a lot of different initiatives. People can get change fatigue, and having leadership involved really sends a message that this is a priority, and it gives permission for others to get involved too. So when we're thinking about trauma-informed training, sometimes I'll ask if the leadership or if that organization can introduce the training and introduce why they think this is such an important part of organizational change. Okay, so the next step, once we know that we want to make change, is to make a plan. And I know this sounds so simple, but all the organizations that I work with, we all just want to get right to the work, right? Which is great. We're all like motivated, helping professionals. And typically they get a little bit annoyed when we want to slow it down. But it is really so critical that when you're thinking about making change in your organization, to spend time thinking about how you want to implement this. And so by implement, I mean things like who needs to be involved in this change? What is the timeline? What are the resources? Who's in charge? What's our goal? How do we know if we've reached our goal? All of these really awesome, important questions that we want to ask before we start making these changes. And the last kind of key ingredient I'll mention is just that we want to keep it small and simple. There's a lot here. There's a lot of work to do. This is a journey. We don't want to tackle this all at once. I think the most success that I've seen is by just having a small, concrete, measurable goal that we work towards. So things like all supervisors in the organization will have the skills and the confidence to use reflective supervision to address secondary trauma. That was a really long goal, but it's very specific, right? And so I just encourage you, as you're thinking about engaging this work within your organizations or within yourself, small and simple is good. Okay, and the last thing I'll just highlight here, so for all these things I just mentioned, all the prerequisites, all the ingredients, leadership involvement, all the goals, we use this as a real helpful way when we're working with organizations to just help them start getting involved in this change process. And this is a kind of an implementation plan. I'll talk about our website in a second here, but you can find this resource on our website, and I also think it's in one of the handouts. So it just has the area of trauma-informed care that you want to work on. What is your goal? Let's make it measurable. Let's make it operational. What are the objectives? Who's responsible? What are the resources we need, etc. Okay, and I'd like to end our time together today with compassion satisfaction. Some of you on this call might have heard this term. For others, it might be new. What I'm talking about here is the pleasure you derive from being able to do your work. And so we often really don't make space for this in our organizations. It's really easy for us to rattle off all the things that we don't like, but really think about when was the last time you were asked what you love about your job and why you do this. And so acknowledging success is a really important part of being trauma-informed and having a trauma-informed organization. So asking these questions of our staff, of our colleagues, in our unit meetings, maybe during our MDT meetings, right? Tell me about your successes. What can you give yourself credit for? I know that when I was back doing trauma therapy, we ended our meetings with something called Grace and Goosebumps. So we just went around the room, after a hard meeting of talking about child trauma, of what is one thing that gave you grace or goosebumps this week. It could be super small, to saying, that family answered my phone call, and they hadn't been, so that makes me feel good. But just making sure we're taking the space to acknowledge our successes and have some satisfaction for the important work that we all do. Okay, so here's the website that I mentioned, axproject.com. We've got more information about trauma-informed care on our website. That menu that you saw in the beginning, that little visual with all the different elements, That's an interactive visual on our website. We'll have resources for every one of those elements of trauma-informed care that we've talked about together today. So with that, I just want to thank you guys all so much for being present with me during this presentation, for your comments, for your feedback, for your engagement, and thank you so much.
Thank you, Melissa. I was going to put a couple of questions into the audience questions that came in at the registration. So the first one is, what steps can I take as a supervisor to make the most impact on creating a trauma-informed atmosphere within our agency?
Thanks, Sally. Yes, I love that question. So I'll try to answer as succinctly as possible, given the time. But supervisors, like I mentioned before, play such a critical role when we're thinking about this work. It's often, there's that saying, like, I don't leave my job, like I leave the supervisor. You guys have such an impact on supervisees. And so really a great way to get started, I can think of two things. One, if there are trainings on trauma that you're attending, that your staff are attending, really think about what are the practice changes that training hoped to accomplish, and how do I bring this up in my supervision? How do I say, hey, we had that training like last week. I wonder, are you finding that you're able to recognize when you're feeling kind of emotional after a case? Another way are just opening that space to bring feelings into supervision. Again, for some that might be really easy to do, for others that might be new, so it might just be a simple thing as, what was that like? What did that feel like for you? And opening that kind of conversation, that dialogue.
Another really timely question that came in, again, in the pre-registration questions, was the question about how to implement some of these in a virtual environment. So
thank you. I'm answering that. Yeah, I'm in that with you. I want to know that too. I mean, we're in this new world together, and we're all trying our best. I'm not used to presenting and training from this virtual platform, but I think we're finding some success together. And so webinars, things like we did today, trainings, virtual trainings, can be really helpful. I think supervision can still happen virtually, and I hope that's happening virtually. So that's still another avenue that we have. And so my hope is that we actually have more connection potentially to each other, given this virtual platform we're kind of getting used to, So I'd just say the webinars, the presentations, and then all of those good websites that I mentioned, the National Child Traumatic Stress Network, and engaging virtually in that kind of platform can be helpful as well.
Mm-hmm. One of the things that we've seen at the team level as we've worked with teams is that sometimes there has been more engagement in the virtual environment, just simply because people don't have to drive to the meeting, and so they get more involvement or more people that participate because it's being offered in a virtual environment.
Absolutely.
Yeah.
Sally, is it okay if I address one of the things in the chat for a second?
Absolutely.
Great. So one of the comments from one of the participants says that it strikes me that although there are many topics discussed here on how to be trauma-informed, much of it is also quite common sense in line with how do we treat people well, right, and as humans. And I completely agree. I think about that all the time, actually. I'm like, this is just good practice, really. Thinking about what are the experiences that these other individuals that I'm engaging with have experienced, and how do I be sensitive and responsive to that? I definitely agree. I think trauma-informed, it can be also just thought of as good practice. I think one thing that separates that is there is a prerequisite that we need the baseline knowledge of understanding trauma and its impacts in order to kind of to do that work. So I just wanted to shout out that comment because I really appreciate it.
Yeah, I liked that comment as well. An additional question about cultural competency and where that fits in. I know you briefly talked about some cultural considerations.
Great. Yeah, absolutely. So this is such, obviously, a real core critical piece of trauma-informed care. It's interesting. I'll say that there's some back and forth, I think, of whether this should be a separate element. So on our menu, it's taken out as a separate element. But I've also heard a lot of feedback that can you really take culture out of anything, or isn't it infused in every single thing that we do? Which I think both are true. I think it fits in everywhere, right? When we're thinking about trauma training, we want to include culture. When we're thinking about our policies and practices, we want to include our cultural lens. When we're thinking about assessment, so all of it fits in everywhere. But I also think there's an importance of separating it out, because sometimes what happens is it can get lost. So how do we also try and include it in all the things that we do, but then also make time for it in our organizations? So how do we have trainings on cultural competency, cultural humility, and how do we then take that and integrate it? So I think there's a lot of work to be done in this area, and it's our job, I think, as an organization to have the responsibility of creating that space for our workforce.
One of the things that recently came to us as we were talking about cultural competency is the ability to evaluate who you're not serving. So have you looked at your community and found people that are not being served, and then how do you reach out and address those, and what kind of steps do you take to get to that population?
Yeah, I think that's so important. Sally, is that a question for me, or is that just a reflection? Sorry.
No, it was just a reflection that.
Okay, great.
Yeah. And then I do have, though, a question for you about how you fit this trauma-informed workplace into the public school setting, and whether you have any ideas about specifically the public schools.
Yeah, I see someone in the chat mentioned CBITS and Bounce Back, which are awesome evidence-based treatments for kids. Those are on the CBC too. Yeah, there's a lot, there's this trauma-informed is a huge movement, right? So we're thinking about trauma-informed child-serving systems. There's a lot of systems that serve our kids, including the schools. And so there are wonderful evidence-based trauma treatments out there that are particularly developed to be implemented within a school setting, like the two that were mentioned. So I would definitely take a look at those. And I hate to keep plugging the same thing, but the NCTSN, the National Child Traumatic Stress Network, they have a child trauma toolkit for educators that's really helpful, and it kind of walks through trauma-informed care within an educational setting. So those are some really good resources, I think, that are particular to the school environment.
Great, thank you. And then we had kind of just a more broader question, most of which I think that you have answered, but how do we move a large organization toward trauma-informed care, and are there differences in how you would do that based on the size of the organization?
That's a great question. So I'll just give a little bit of context to my answer. So in the work that I do for that ACTS project that I highlighted before, we partner with child welfare counties across the state of California. And for those, probably most of you who are not familiar with child welfare counties in California, they each operate quite differently, and they're very different sizes. So we work with a huge county such as LA to a tiny, tiny county such as Tuolumne. And it's very interesting. There are a lot of overlaps in the challenges and the barriers that they face. But I would say one of the more helpful ways when we're thinking of large organizations, and I mentioned this earlier, is to really have a committee or a point person that is responsible for kind of holding this trauma-informed lens within the organization. So, for example, some of the counties that I work with have trauma-informed committees. They're actually just volunteers. It's kind of extra that they do on top of their work, but they get together as a group, as a team, once or twice a month, and they talk about all these different elements of trauma-informed care and who they might want to bring in as speakers and what kind of resources are out there that they can bring into their organization, and really just keeping it alive within their organization, really championing that. So I think the more that organizations can have a structure set in place, and I know that's not possible for everyone, but I found that to be really helpful in being able to make this kind of change.
Yeah, and that leads to right into the next question, which is what kind of things can the champion lead, or what kind of behavior from them, like behaviors typically would move things forward that a champion would do?
Mm-hmm. Yeah, I think there's no limit, no limit to the work that we can all do, the champions that we can all do. But I think most of the things that I mentioned on this webinar are things that us as individuals can really take on too. I'm just thinking of an example that comes to mind. And again, I'm pulling from my own experience within the child welfare organizations, but also within licensing world too. There was a desire for this individual. I really wanted training around secondary trauma, and particularly in a way that they can provide peer support to one another. And so they just reached out to see what trainings are available out there and asked leadership if they could bring this into the organization. I think individually too, asking to create a trauma-informed committee and being a champion on that committee can be a really powerful move. I think champion can lead anywhere between setting up meetings like that and bringing in trainings to just talking about this work in your meeting. So if you're hosting a meeting and you start with a deep breath just to ground ourselves and be mindful of where we're at, all of this is trauma informed. So it's even little things, asking those grace and goosebumps at the end of your MDTs. These are trauma. These are ways that you're opening that space to show that we know trauma has an impact on us, and we're bringing that into the organization.
Great. Well, Melissa, thank you so much, and thank you for bringing this presentation and for taking the time to answer questions that people asked as they came in. I appreciate very much, and we can turn this back over to William to wrap up on behalf of INTAC.
Great. Thank you very much. Yes. Thank you very much, Sally, and thank you, Melissa, for an absolutely excellent and wonderful presentation today, and thank you to our audience members. We will conclude today's webinar, but before I let you all go, just a few last-minute housekeeping items just to keep in mind. One, please, if you'd like to get in contact with INTAC, you may do so by reaching out to us on the information on this slide, or you can also be sure to subscribe to our INTAC listserv, or you can text INTAC to 22828 in order to receive updates from us in regards to upcoming web events. If you'd like to get in contact with OJJDP, you may do so via the OJJDP TTA Help Desk. You can do so through the information on this slide. You can also select the sign up button in order to sign up for OJJDP's listserv as well. Do you have a training or technical assistance need? Well, if so, please submit your request to OJJDP's TTA 360 platform. You can access the platform through the URL link on this slide. As a reminder, this and other webinars are indeed archived on our INTAC YouTube channel. If you'd like to receive supporting materials related to this or any other of the webinars that you see on our INTAC channel, you may reach out to the OJJDP TTA Help Desk, and we can follow up with you with any of those supporting materials. Please be sure to join us for our upcoming webinars that we have with our colleagues at Zero Abuse and also the Innocent Justice Foundation. You can click Learn More to learn more about each of these webinars, or you can select Register Now to register for the webinars. And then finally, remember that we do have our last training in the series with our colleagues with WRCAC coming up on October 20th. Please feel free to register for that webinar now. And then we also have another webinar coming up with our colleagues with the Innocent Justice Foundation as well on the 28th. So feel free to click register now to register for each of those webinars. And finally, one final poll for today. And we'd like to know, how do you plan to apply the information from this webinar in your work? Please note that this webinar is multiple select, so you may select as many options as you would like here. And with that, I will leave this up just for a couple of more seconds for folks. But thank you all very much for attending today's presentation. Have a wonderful afternoon. Goodbye.